How are kidney cancer follow-up guidelines created? Have you ever wondered how doctors decide on the best follow-up care for kidney cancer patients? The creation of kidney cancer follow-up guidelines is a careful process that combines scientific research with expert opinions. It starts with a thorough review of the evidence. Expert panels conduct extensive literature searches to find studies that focus on kidney cancer outcomes after treatment. They look at important factors like recurrence risks, the effectiveness of imaging tests, and how patients are monitored over time. Next, the quality of this evidence is assessed. Each piece of information is categorized based on its strength, whether it is high, moderate, or low. If there isn't strong evidence available, the guidelines relying on clinical principles and the expertise of the panel members. This ensures that even when data is limited, the recommendations are still based on sound medical judgment. Another important step is risk stratification. This means that follow-up recommendations are tailored to each patient's risk of recurrence. Doctors use validated prognostic models that take into account tumor characteristics like size, stage, and histology. For instance, a patient with a low-risk tumor may not need as frequent checkups as someone with a high-risk tumor. The guidelines are developed by a multidisciplinary expert panel. This group includes urologists, oncologists, radiologists, and other specialists who work together to interpret the evidence and ensure that the guidelines reflected the best practices available. They also consider factors like patient safety, quality of life, and cost-effectiveness when making their recommendations. Once the evidence is reviewed and interpreted, the panel formulates specific recommendations. These include details on the timing and type of follow-up evaluations, such as physical exams, laboratory tests, and imaging studies like computed tomography scans or magnetic resonance imaging. The recommendations specify how often patients should have these follow-up visits based on their individual risk categories. Importantly, these guidelines are not static. They are regularly updated to include new research findings, emerging technologies, and advancements in clinical practice. For example, recent updates have combined follow-up guidelines for kidney cancer with those for localized renal masses, making the advice more streamlined and relevant. In practice, follow-up care after kidney cancer treatment usually involves scheduled visits where doctors take a patient's medical history, perform physical examinations, conduct laboratory tests to monitor kidney function, and order imaging studies to catch any signs of recurrence or metastasis early. The frequency and duration of these follow-ups depend on the individual's risk and overall health, balancing the need for early detection with the goal of minimizing unnecessary tests. This structured approach ensures that kidney cancer follow-up guidelines are based on solid evidence, are centered around the patient, and can adapt to new information. This ultimately supports optimal kidney health and effective cancer management after treatment. Always remember to consult with healthcare professionals for personalized medical advice tailored to your situation.